Morning, everyone. So the topic for today's discussion by me is to explore the possibility of using OCT angiography for early detection of glaucoma progression. So glaucoma progression can be computed via functional testing or structural testing. Functional testing is done with the help of visual fields. Structural testing is usually done with the help of OCT, while OCT angiography is a new upcoming technology for glaucoma progression. So the objective of the study was to compute the glaucoma progression on OCT angiography and compare it with visual fields and RNFL analysis on OCT. So brief about OCT angiography and glaucoma. OCTA is a non-invasive and objective assessment of optic disc vascularization. Vessel density, which is the main parameter in OCTA, is percentage of area covered by vessels over the total area. Areas of vessel density decline on OCT angiography corresponds to the areas of nerve fiber layer loss on OCT. So ours was a prospective non-randomized study on 64 eyes of 38 glaucoma patients. The inclusion criteria were age more than 18 years. We included patients of early to moderate glaucoma with no other ocular disease. So we had 2 visits. At first visit, 2 reliable visual fields were done. 3 OCT scans of nerve fiber layer of the disc and 3 OCT angiography scans of optic disc were done. And after 9 to 12 months of follow-up, the same scans were repeated. So how do we analyze progression? So on visual fields, which was done on Humphrey Visual Field Analyzer, glaucoma progression analysis software was used to compute progression. On OCT, more than 5% decline in the sectoral RNFL thickness was considered as progression. And on OCT angiography, which was done in Heidelberg Spectralis, both quantitative as well as qualitative decline was considered as progression. Quantitative when more than 5% vessel density decline was there, and qualitative when was done by 2 glaucoma experts, both were blinded. So this is a representative image showing corresponding defects. We can see a superionasal notch, and similarly in the same area correspondingly we can see a vessel dropout, nerve fiber layer thinning on OCT, and visual field defect. Coming to the results, the total number of eyes were 64, mean age was 53.6 years, follow-up duration was at 9 to 12 months, mean vessel density in patients of early glaucoma was 37.4, while in moderate glaucoma it was 37. 8 eyes progressed of early glaucoma on OCT angiography, while 15 eyes progressed of moderate glaucoma on OCT angiography. The mean vessel density decline in OCTA progressors was minus 4.1, while in OCTA non-progressors it was just minus 0.75. There was a moderate positive correlation between nerve fiber layer thickness on OCT and vessel density on OCT angiography in our study. So this is just to summarize the overall progression. 14 eyes progressed on visual fields, 18 on OCT, and 23 on OCT angiography over the follow-up period. This is a Venn diagram showing each number of eyes, how they progressed. So we can see 8 eyes progressed on all the 3 methods, that is visual field, OCT angiography, and OCT, while 9 eyes just progressed on OCT angiography, 5 just on OCT, and 3 just on visual fields. So this is to compare the progression on OCT angiography versus visual fields, which is the standard. So we can see when visual field progression was present, in those eyes, OCT angiography progression was also present. So out of 14 eyes of visual field, 10 eyes also progressed on OCT angiography. And when visual field progression was absent, OCT angiography progression was also absent. So the agreement between OCT angiography and visual field was statistically significant with a coherence kappa of minus 0.369. Similarly, when we compare progression on OCT angiography and OCT, most of the time, out of 12 out of 18 time, when OCT progression was present, OCT angiography progression was also present. And when OCT progression was absent, OCT angiography progression was also absent. And the agreement between the progression on OCT angiography and OCT was also statistically significant. So to conclude, our data suggests that OCT angiography correlates well with visual fields and appears to pick up glaucoma progression earlier than OCT. Therefore, OCT angiography offers to be a potential tool for early detection of glaucoma progression in the future. Thank you.
Any role of IOP while performing the OCT angio.
Yes, ma'am. If the IOP is very high, the vessel dropout is more.
So have you considered that also along with this?
Yes. So the IOP was in most of the patients were in target range.
Progression rate with a 9-month follow-up you have.
1 year almost.
How many patients have progressed?
Yes.
Have you selected patients whom IOP was not under control?
Exactly.
We,
Not many
Yes.
ma'am, we selected patients who were progressing on visual fields, who were already progressing on visual fields.
So this is an additional, but it's not the whole and soul tool which can guide you.
Sorry, ma'am.
How does it
Thank you.
Thank you.